In 1978, my grandfather, Dr. Howard DeBossi Giles, passed away, leaving behind a library of more than 200 medical books. I was very young, so I never really got to know him. Today, I'm opening one of those books to try to discover a little more about the man who owned it. I'm Lisa, and this is Finding Dr. Giles. This is book number 4, Diseases of the Chest, 1935 to 1940, Managing Editor, Murray Kornfeld, Editor-in-Chief, C.M. Hendricks, M.D., initially published by the Federation of American Sanatoria and later the American College of Chest Physicians. What I have here is a collection of 30 original issues, ranging from the very first Volume 1, Number 1, in March 1935, up through Volume 7. This publication actually still exists today, and they have changed the name simply to Chest. My grandfather, Dr. Howard Giles, would have been 36 years old when this first issue was published, and 8 years into his medical practice in Columbus, Ohio. Looking at Volume 1, Issue 1, Kornfeld created this monthly journal specifically to help general practitioners, physicians just like my grandfather, to recognize and diagnose and manage tuberculosis on the front lines. The organization rebranded from the Federation of American Sanatoria to the American College of Chest Physicians, and the journal took on a new aesthetic, complete with updated cover colors. These pages give us an unfiltered look at mid-1930s pulmonary medicine, early thoracic surgery, and the period of pharmaceutical and sanatorium advertisements. Flipping through these pages, it's interesting to see the advertisements for the different sanatoria. Loomis Sanatorium, Albuquerque as a destination, the Homan Sanatorium. It's just one sanatorium after another. St. Joseph's. History of the sanatorium movement, which I find fascinating, given the times, because there are no such things today. It has probably been the dream of most physicians who have had to be under treatment for tuberculosis to control a place where ideas, formulated during hours of contemplation, could be carried out. It was undoubtedly for some such reason that Bremer first started his sanatorium in Silesia and became the originator of the modern sanatorium treatment of tuberculosis, though others had made the attempt before. He wished an institution where he could only treat his patients with rest, but also by certain exercises, as he had the idea all tuberculosis patients had small, underdeveloped hearts. The sanatorium idea was well established in Germany when Trudeau first read of it in 1882. Trudeau had had the experience of caring for his brother until he died of an acute case of tuberculosis. For several months he was confined in a room with his brother, the windows of which were never opened, by the orders of his physician. It made a deep impression on him when he also had contracted tuberculosis and had spent some time in the Adirondacks in the open air with much benefit. He had gone to the mountains not because of the therapeutic effect, but because he enjoyed the kind of life he could live there. Realizing the improvement, he was in a receptive mood to be influenced by the sanatorium idea. It was not long, however, before the sanatorium idea, as developed at the Adirondack Cottage Sanatorium by Dr. Trudeau and his associates, began to influence the treatment of tuberculosis. The sanatorium became a place for treatment as its main objective rather than a place for segregation or just housing the tuberculous. Then the need became apparent for sanatoria in favored locations where patients could receive very specialized and individual care, and the private sanatorium came into being. The private sanatorium had been one of the most important factors in the campaign against tuberculosis in not only developing the treatment, but in giving patients surroundings where they could pursue a long period of treatment in a congenial atmosphere. Fascinating. When these issues were first printed in 1935, tuberculosis was the leading cause of death in the United States and claimed over 70,000 lives annually. In this pre-antibiotic era, there were no medicine cures. The medical establishment relied heavily on strict regimens, complete bed rest, overfeeding, and high-altitude fresh air, sometimes having patients sleep on open-air porches even in the dead of winter. Because tuberculosis was highly contagious and airborne, patients were isolated in dedicated sanatoriums to prevent family and community transmissions. Tuberculosis was often called the White Plague because of the severe paleness, anemia, and rapid weight loss it caused. Tragically, nearly 50% of patients admitted to a sanatorium died within 5 years. Tuberculosis didn't affect everyone equally. Due to systemic poverty, overcrowding, and severe economic and housing instability, Black Americans suffered disproportionately higher rates of infection and mortality, a disparity that persists in global public health today. For a Black physician practicing in the 1930s and 40s, staying current with journals like Diseases of the Chest wasn't just academic curiosity. It was a necessity for serving a vulnerable community. The medical landscape finally shifted in 1944 with the discovery of streptomycin, the first effective antibiotic against tuberculosis. By the 1950s, drug therapies began replacing long-term isolation, and sanatoriums across the country began closing down. While many people think of tuberculosis as a disease of the past, it remains the world's leading infectious killer from a single bacterial agent, causing over 1.2 million deaths annually worldwide. That is shocking. I had no idea that tuberculosis was still a killer of so many. I shared in episode 3 that my grandfather frequently appeared in both the regional Black newspapers like the Ohio Sentinel, the Ohio State News, the Call and Post, and the Pittsburgh Courier, but also the mainstream newspaper, the Columbus Dispatch. Not only were the references in the newspaper made to his medical contributions, but also to his community service. And he also frequently appeared in the society pages. These early 1930s journals directly preview the public health work that he would champion later in his career. By July 1958, The Lantern, which is the Ohio State University's student newspaper, recorded my grandfather serving as chairman of the local Tuberculosis Society. Research Unit picks Guthrie. William S. Guthrie, Executive Dean of Student Relations, has been appointed to the Tuberculosis Society's Christmas Seal Research Committee. Under the chairmanship of Dr. Howard Giles, the committee will consider requests for local research projects for which the Society has allotted $6,000. First grant approved by the committee is to Dr. Eric M. Peterson, resident of Ohio Tuberculosis Hospital, to study the detection of pulmonary diseases through sweat. A $20,000 grant will finance a year's study of sweat abnormalities and their relationship to chest ailments often seen on X-ray and frequently confused in diagnosis with tuberculosis. Dr. Peterson will survey 2,000 persons by the rapid screening fingerprint sweat test and will analyze sweat from 200 patients. That is incredible. $6,000 in 1958 would be about $70,000 today, according to Google. And $20,000 would be about $231,000. My grandfather was highlighted again on May 18, 1961 in the Ohio Sentinel. Reverend C.F. Jenkins, 189 North Nelson Road, pastor of Second Baptist Church, and Dr. Howard Giles, 191 Woodland Avenue, have been appointed members of the program and nominating committees, respectively, of the Tuberculosis Society of Columbus and Franklin County. John E. Nippert, president of the society, announced Monday. Dr. Giles' program committee recommends any expansions or modifications of the society's program deemed necessary after study of the TB situation in Franklin County. Fascinating that they would print your home address in the newspaper that way. Seeing these journals in my grandfather's personal collections shows the deep foundations of his career. studying the latest clinical literature as a young doctor during the height of the crisis, and eventually stepping up to lead community-wide eradication efforts decades later. Case report: Rosa M., age 16, came to see me in March 1923. She complained of a cough of several months' duration and fever. She was a well-nourished girl, weighing 160 pounds, and worked as a hotel maid. Physical examination showed fine moist rales after cough in the right infraclavicular region. Her temperature was 104 degrees, pulse 120. I put her to bed at once. However, she did not improve, and 6 weeks later, she had a hemorrhage. I compressed her lung with wonderful results. The bleeding stopped at once, and the temperature came down to normal after a few injections of air. I compressed the whole right lung at first. After a year's time, I let the lower lobe out. I kept up the compression for 5 years, at which time I allowed the lung to re-expand. On doing so, she had a return of the cough and sputum and moist rales over the upper lobes, so I put the lobe down again, and the cavity that had formed before gas was begun was closed again. This girl was able to work after she had taken air for 4 months. She worked steadily with no time off except for an occasional cold. At this time, she married and was confined and delivered of a healthy child 18 months later. She had no trouble during pregnancy. She took her gas regularly. Her weight has steadily increased. It is now 190 pounds. She has never had any complications develop or any fluid at all. She comes in for gas every 6 weeks. E.D. Price, M.D. Tuberculosis, to be cured, must be diagnosed early. 90% of early type cases get well. The other 10% die because of poor advice or because they did not take good advice. The family physician is the first line of defense against a beginning tuberculosis. If he fails, the story is a long, drawn-out fight against overwhelming odds, usually ending in hopeless invalidism, or far better, the grave. Leroy S. Peters, M.D., Albuquerque, New Mexico. When I look closely at these journals in my grandfather's personal collection, this shows me the foundation of his career, how he studied the latest clinical literature as a young doctor during the height of the tuberculosis crisis, and later stepping into leadership with the Tuberculosis Society. So with every book, I learn a little bit more about my grandfather and the work that he did. Thanks for watching this episode of Finding Dr. Giles. If you have thoughts on this history, or if you know of my grandfather's work in Columbus, Ohio, please leave a comment below. I'd love to hear your stories. If you're enjoying this journey through medical history and archival discovery, please like this video and subscribe to the channel to follow along. And I hope to see you right back here as I take a look at the next book.